Okay, what is the most appropriate management in this patient? All right, so it looks like we have a breast question here. 38-year-old woman presents to clinic, routine annual checkup, no significant past medical history, no family history of breast cancer. On physical exam, no breast masses or axillary lymphadenopathy is noted. Screening mammogram is performed, which reveals an area of focal asymmetry in the right breast with associated microcalcifications. Okay, core needle biopsies performed, and the histopath shows intralobular fibrosis and an increased number of acini, I'm not sure how to say that, per lobule, and a proliferation of myoepithelial cells. Okay, what is most appropriate management? So if she's having this, okay, proliferation of myoepithelial cells, she had the microcalcifications. To me, that's immediate standout for cancer. I mean, she has no history of it. I wouldn't. Okay. Is it one? So refers to, okay. I wouldn't repeat mammogram. I would get rid of that. Hormonal therapy, I'm not sure what they're referring to unless they're talking about like estrogen receptor blockers or something, if that's what they mean by hormonal therapy, which I think they do. I always get those drugs confused. I'm not sure. A lumpectomy, is it a clear lump? I mean, there's no breast masses or axillary lymphadenopathy. It seems more of a diffuse microcalcifications. Okay. I don't think you need to MRI the breast. You already imaged it and took a biopsy. I don't think you need another image. So it's either hormonal therapy or the referral to breast surgeon. Hmm. I mean, I think it's cancerous because that word microcalcification, um, breast pathology stuff always gets so confusing to me. Let's see. I don't know what a breast surgeon would do. I mean, there's fibrosis. I don't know if you have to take that tissue out. Um, it seems like either like intraductal or DCIS here. Maybe initiate hormonal therapy because it's less invasive, because like that rule of like, all right, less invasive first and then the surgery possibly. So yeah, that's what I would go with.
Okay. So
Repeat mammogram.
yeah, let's see kind of what they're going for here. Shows consistent of benign breast conditions, sclerosis.
Sclerosing
Yeah, so there's a sclerosis
adenosis.
adenosis, right? So
Okay.
intralobular fibrosis, actinic, and myoepithelial proliferation. So one of the
Okay.
things that you're looking for on this is a path question in a sense, right? So
Okay.
you're worried about kind of is it, outside of the tubules, right? And kind of,
Did it
um
invade the basement membrane, right? Did it get
exactly.
past that? Okay.
Exactly, exactly. So this is a little tricky one, right? So
Okay.
microcalcifications, right, is usually cancer, right? Which is why you get a core biopsy, but it showed that it's benign, it's sclerosing adenosis. So
Okay.
you can follow up on this. But let's talk about it a little bit. Okay, so initiating hormonal therapy, right, lumpectomy, right, and referral to breast surgeon, right, and we'll kind of talk about the MRI. If you think it's cancer, right, you got to be thinking, okay, if it is cancer, let's say you're like, okay, you think it's DCIS or whatnot, your thing should be
Mhm.
thinking of you need to escalate the care now, right? So
Okay.
the care you need to refer to breast surgeon, right, which is the one that's going to be doing the cancer surgery. You need to probably start setting up like medical oncology and radiation oncology, right? Those are kind of your referral bases, okay?
Okay.
Because they're going to be the ones that say what kind of hormonal therapy, right? So you don't want to just start random hormonal therapy. You want to do more
Okay.
workup. Also, on top of that, right? MRI of the breast and things like that, depending on how bad like the cancer is and the breast cancer is like I need a little bit more imaging for the roadmap of my surgery. That might be
Okay.
ordered a little bit later on for staging. But yeah,
Okay.
so those are the things you're kind of thinking about if you're thinking cancer, right? Do I need to escalate care, kind of, get them into oncology surgery, which is the breast surgeon, also on
Okay.
medical oncology and radiation oncology, and then they'll kind of take it from there. But yeah, this
Okay.
question is a little bit confusing because of the sclerosis and adenosis, which is a little bit more, rare of a question that they ask you, which can be deceived as cancer, but
Okay.
the pathology, right, doesn't kind of show cancer. So
No, because it's really just that intralobular fibrosis, right? And
exactly,
it's like
exactly.
that's
So
it's
just
not
scar tissue.
cancer. Okay.
Yeah.
Okay.
Yeah.
Makes sense.